Steve Adubato here. I want to just acknowledge that recently my co-host and the executive producer of our series that we do called Lessons in Leadership, we had the chance to sit down with Michellene Davis, who's a great leader and also the Vice President and Chief Corporate Affairs Officer at RWJBarnabas Health. Mary and I spoke with Michellene about a whole range of issues having to do with race, COVID-19, gender equity issues, whole range of important issues. We thought the conversation was so important, even though it was on lessons in leadership, we thought it would work really well here as well. Michellene Davis. Welcome back to Lessons in Leadership. I'm Steve Adubato. That is, you'll see her on camera, my co-host and executive producer of the series, Mary Gamba. And Mary, we continue to have Michellene Davis, who is in fact the Executive Vice President and Chief Corporate Affairs Officer, RWJBarnabas Health. Michellene, let's shift gears. I want to talk about something that you and I talk about a lot offline. You've written about this. You've been published on this. How could it be that so many people of color are disproportionately, based on the population, getting sick and dying from COVID-19? Why is that happening?
So, Steve, thank you for the question and for paying attention to the topic. I think that the national discussion has turned in this direction, but those of us who have been really fighting to reduce and indeed eliminate healthcare disparities for some time are not surprised. This is literally not something that is happening episodically. It is really the accumulation of systemic and structural issues that have existed for decades really just coming to bear right now. And so as a result of that, what you see is the fact that these individuals, many of whom already either grew up in and or currently reside in densely populated urban environments, really are those who have long-term suffered with chronic health issues. But those chronic health issues have been contributed to as a result of their environments, as well as just systemic and structural, quite frankly, policies and zoning, i.e. redlining, et cetera, that have really contributed to their outcomes.
Michellene, sorry for interrupting. Are we talking about the social determinants of health? Is that what we're talking about?
We are, Steve. Thank you very much for
You've taught us well.
So as you know, the social determinants of health are those things which really impact your health outcomes that are outside of just your visit to a doctor's office. So where you live, whether or not it's a safe neighborhood and safe environment, whether or not you live in safe and affordable housing, or are you literally living in a space that has issues that really come from mold, et cetera, whether or not your air is pollution free, or whether or not you live in one of the communities I just mentioned, that as a result of historical and intentional zoning and redlining winds up being in an environment where others who primarily look the same reside, but then akin to that, right, within that environment, you also have a tendency to see higher industrial plants, right? So then you'd have the county's garbage incinerator would be there, a tire factory, a cement factory, and all those things tend to also be co-located within these environments.
Does COVID-19 exacerbate these issues, these health issues?
Absolutely. You know, Steve, someone called it the great equalizer. And I understand their intent. I believe it was well intended. And really that was made in order to show that no one can be educated out of literally having COVID-19. No one can be wealthy enough so that you're no longer within that risk pool. But the issue truly is that it is not. It is just a great magnifier. What it is magnifying is the fact that we are all intricately intertwined, that what happens to the least of these, right, can also happen to the most of these. What it evidences, what it shows is the fact that all of a sudden we have a world that has been held up by the essential workers who make the least, and that these historical disparities, that the structural and systemic inequity that we're talking about has always existed, again by design, and that as a result, if we do not do something to address it now, after we can no longer say that we don't see it or we didn't know it was there,
It's clear.
right? That not only will those communities be impacted, but every other community as well.
So listen, Mary, I want you to come back in here because disclose a couple of things, and I want to continue this discussion about these disparities and also about some male-female gender issues as well.
Sure.
Michelene's been a leader in this regard as well, but I want to disclose that RWJBarnabas Health is an underwriter of our public broadcasting programming, and also Michellene is on the board of our not-for-profit organization, the Caucus Educational Corporation. Mary, follow up because I could see how engaged you are.
Thank you. Yeah. And Michellene, thank you so much for sharing. I think you're opening up a lot of people, our viewers' eyes on what the issue is. And in terms of a lot of times you'll, in reading about this, some people will say, oh, well, high risk people of color, they should shelter at home. Why don't they just do that? What do you say to those people in those situations? Because, it seems easy enough, shelter at home, but why is that not a real possibility?
Yeah, so thank you, Mary, for that question. I always, I think the people who are concerned enough about reminding us that that's the mandate, that's the order, that's what they should do. And then I look at them like two things. One, and how would you eat? Because the individuals who are stocking your shelves every day, who are driving your trucks every day, that the individuals who are delivering your food every day, who literally are picking up your garbage, right? What would your community look like then, right? So two things. One, that's a point of privilege, right? So you are looking at that situation through a lens of your privilege, which is not, quite frankly, appreciative of the fact that that is not where everyone is, right?
And a lack of empathy.
Indeed, my friend, a lack of empathy and so much less no compassion at all. So one of the additional elements there is also the fact that, shelter in place is not necessarily the same for all. It's one thing when in fact you are sheltering in place and you can be socially distancing within your home. But for those who live in multi-unit dwellings, sheltering at place does not necessarily mean that you are also socially isolated, right? I get on an elevator to a building that it has 20 stories and a public housing unit. I'm not certain that is socially distancing. It doesn't actually accomplish quite the same things. I live in a multifamily unit with several generations of families. They're in and out. So I just want to make certain that people are aware that that looks different for everybody else. It's not just that I can stay at home and not worry about it. There are still issues that I need to actually address if in fact I am there. The other side of that is, right, in order to come and stock your shelves, I had to take 2 buses to get there.
True.
And that bus is crowded.
Every time.
Every time. And if you then say, we're only going to let the bus or have the bus be 1/3 full of people, that means you don't have that bus. You can't get to work. I mean, what Michellene has taught us over the years in many, many conversations on the air, but mostly off, is that that transportation is a social determinant of health. Yeah. Economics, housing, all kinds of issues. But how many of us are sitting there thinking, well, I'm going to be safe, so I'm not going to get on that bus. That bus is the only way you get to work and feed your family. Go ahead, Michellene.
So I think that that's exactly right, Steve. And I think that there are many individuals who have been given the wonderful grace and opportunity this lifetime to not experience what those harsh realities are. Listen, I am a caretaker of a mother who I adore, who is an elderly woman with Alzheimer's, who has had a heart attack and a stroke within 6 months of each other this year alone. In the very beginning of this, I had to make the decision to send her aides home because while they are lovely, they take public transportation in order to get to the house, in order to care for her. They live in multifamily dwellings with multi-generational family members. And so as a result of that, the element of risk is so much higher because exposure to even one person increases that much more.
Just to switch gears very quickly, and I know we won't totally get into it, but
you can do gender a little bit?
Yeah, I do. And Michellene, you have spoken about and written about gender equity. Really, how has COVID impacted it in a 1-minute snapshot? What is happening?
So as COVID had been the great magnifier on other issues pertaining to disparities in Black and Brown communities, COVID-19 has also been an incredible magnifier about why it is so incredibly important and why it is such a dire need in order for us to actually achieve pay equity here, right? So take, for example, the impact that we're seeing on Black and Brown communities alone. Add to that the fact that what we are seeing is actually African American men and Latino men dying at even a faster rate in this faster dying and more frequently perishing community. So we have all of these households which now have lost that dual income as well as having lost a loved one. So as a result of that, imagine for a moment that you have the women who are in these households, many of whom, actually 80% of which, if you combine all communities, are actually female-headed households anyway, right? Add to that the issue of pay inequity. So we know that white women, my sisters, make 82 cents to every one white male dollar. We know that African American women make upwards of 65 cents, right? And then Latina women, our sisters, are at 62 cents. Wow. So take a look at what that means given this pandemic and the extension of what many of our states are under right now as to literally a shelter-in-place order. And we have families that are going to be going without economic income for a significant period of time. And then, quite frankly, on the other side of that, will never be able to truly make up for what they've lost. But even had it not occurred, they were always at a disadvantage. Yeah. And then we wonder why these communities can't just stand up by their own bootstraps. Well, it's because they have literally put on the bootstraps of others and not been paid for the ones that they've been building all the while.
You know, Michellene has laid out so many important issues, questions, and we don't delude ourselves into thinking we have answered them, but she's put them on the table. I promise you the conversation will continue. I just want to say thank you, Michellene, for joining us. Best to you, best to your mom, best to the people on the front lines at RWJBarnabas Health and all of the hospitals and hospital systems we work with those, the term heroes getting thrown around a lot, and it could never be more appropriate than it is right now for those doctors, nurses, respiratory therapists, technicians, all of them. Michellene, thank you so much for being with us.
Thank you, Steve. Thank you, Mary.
Thank you.
This is Steve Adubato. That's Mary Gamba. That is Michellene Davis. Catch you next time.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Turrell Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, Horizon Blue Cross Blue Shield of New Jersey, TD Bank, Summit City MD, the Healthcare Foundation of New Jersey, New Jersey Sharing Network, Gibbons PC, and by the Fidelco Group. Promotional support provided by ROINJ and by the New Jersey Business and Industry Association. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.